Bangalore, India's tech capital, is once again in the spotlight, but not for its startups or software exports. This time, it's a sharp rise in COVID-19 cases, driven by the emerging NB.1.8.1 variant. Hospitals are reporting a steady increase in admissions, while Karnataka's health department has issued renewed alerts. But here's the twist. AI is stepping in faster than ever before. From real-time outbreak tracking to hospital triage systems, Bangalore is turning into a testbed for AI-powered pandemic response. One of the first lines of defense? AI in COVID detection. At Kempegowda Institute and other city hospitals, smart diagnostic tools are scanning chest X-rays and flagging early-stage pneumonia with near-instant accuracy. Startups like Qure.ai and DeepTek are using machine learning to identify potential COVID-positive patients even before PCR results arrive. This isn't science fiction. It's how India's top healthcare AI platforms are battling an invisible enemy. Meanwhile, AI surveillance systems across Karnataka are analyzing mobility data, testing patterns, and hospital logs. They're identifying hotspots, predicting case surges, and guiding containment strategies in real time. The goal? Stop clusters before they explode into full-blown community transmission. And it's working, at least partially. In Whitefield, for example, AI systems helped flag an unusual spike in school absenteeism, prompting localized testing drives. That led to early identification of NB.1.8.1 variant clusters in tech campuses and residential complexes. But what exactly is the NB.1.8.1 variant? It's a sublineage of Omicron that appears to spread faster in crowded, air-conditioned environments, think office parks and malls. Virologists are closely watching its mutation patterns, and AI is being used to compare it with previous waves. Every genome that gets sequenced in Karnataka is fed into national AI models that assess risk, transmissibility, and immune escape. This is how India's AI pandemic infrastructure has quietly evolved since 2021. Back then, most of the systems were reactive. Today, they're predictive. In fact, several Bangalore-based AI models are capable of forecasting ward-level outbreaks 3 to 5 days in advance. Hospitals are also deploying AI for internal decision-making. At Manipal and Narayana Health, bed allocation, oxygen forecasting, and patient triage are all optimized by machine learning. And let's not forget India's AI-powered call centers. Behind the scenes, bots are calling households in containment zones, collecting symptom data and updating health dashboards. The data they collect is routed back into predictive systems that help determine which areas might need mobile testing vans next. This is AI in Indian hospitals at its most impactful. It's not just about smart algorithms, it's about faster response times, fewer diagnostic errors, and smarter logistics. Doctors are still leading the fight, but now they have AI co-pilots. And these co-pilots don't get tired, don't miss patterns, and don't panic. Karnataka's COVID AI dashboard, available publicly, lets you see real-time case counts, test positivity rates, and even predictions. It's part of a broader mission to make healthcare transparent, tech-driven, and truly citizen-friendly. But of course, no system is perfect. Challenges remain, like gaps in data accuracy, underreporting, and delays in genomic sequencing. And while AI models are powerful, they can't replace boots-on-the-ground healthcare workers. That's why the best results are coming from AI-human partnerships, where frontline staff use machine predictions to make better decisions. So what's next for Bangalore? Expect more AI-integrated mobile clinics, better symptom reporting apps, and AI-guided vaccine deployment strategies. Even drones are being tested to deliver medicines to quarantine zones in rural Karnataka. India may not have the same healthcare spend as the West, but it's proving that smart tech can amplify limited resources. And Bangalore, ground zero for India's tech revolution, is leading the charge once again. Will this wave be controlled better than the last? With AI watching our back, there's a fighting chance. Subscribe to AI Medics Revolution for more breakthroughs where AI meets healthcare. Stay informed and ahead.